All right, good evening, everyone, and welcome to another episode of NMA ITV. My name is Dr. Aaron Dotson. I'm in my last few months of residency and soon to be a cornea fellow out in San Francisco, California. I'm joined here tonight with my co-host, Dr. Daniel Laroche. Dr. Laroche, can you introduce yourself?
Good evening, everyone. Dr. Daniel Laroche, eye physician and surgeon, glaucoma specialist here with NMA TV. Pleased to be here tonight with this great talk that we're going to have. And I'll turn it back over to you, Aaron.
Absolutely. So, yes, just like what Dr. LaRose said, we have a really, really great talk for this evening. So, NMA ITV was initially created to have physicians like ourselves talk about various eye related conditions and just giving you guys, to the general public, some good information to help the wellness and overall wellness and longevity of vision and for eye health. We have here this evening two very special guests who will be talking about the effects and sometimes the dangers of alcohol and alcoholism in relations to both the brain as well as the eyes. We have both Dr. Adesina as well as Dr. Douyon here tonight. So we'll start off with Dr. Adesina. If you could quickly just introduce yourself, give us a little background about what it is that you do, and then we'll go to Dr. Douyon.
All right. Well, thank you very much for having me this evening for this important conversation. My name is Adesina. I am a neuro-ophthalmologist and orbit specialist at the McGovern Medical School at UT Houston. I'm the medical director and the director of neuro-ophthalmology here.
Excellent. And then you, Dr. Douyon?
So hi, my name is Dr. Phillipe Douyon. I'm a board-certified neurologist and clinical neurophysiologist and stroke neurologist for a company called Telespecialist. I'm also the co-founder of SeriSync, where we use artificial intelligence and quantum machine learning to help diagnose dementia early and to come up with treatment plans for people with who are suffering from dementia. And I'm the co-founder of the Inley BrainFit Institute, where we provide information about how people can keep their brains healthy, but also become the leaders that their brains need them to be in order for them to create the health and the lives that they want for themselves.
Excellent. Well, once again, thank you both for joining us here this evening. We're going to get things started here with Dr. Douyon first. But before we do get started, we want to just lay out a few ground rules. We do have a live chat that is available right now. So if you have questions or comments at all, feel free to share them within the chat. But by all means, please do be respectful. We want to be as respectful as possible because we're all here to learn and to share this good information. So without further ado, I'm going to put Dr. Douyon's slides up here in a moment, and we will have him take things away. Hey, sir, I think you're muted right now.
Can you hear me now?
There we go.
Perfect.
Excellent.
So I'd like to start off by saying that they lied to you when they first told you that alcohol was good for you. When they told you that a glass of wine per day was good for your heart, that was a lie. And the reason that they told you that had nothing to do with the alcohol itself, but was due to a chemical that we find in fruits and vegetables, and especially grapes, called resveratrol. And that chemical happens to be a powerful antioxidant and anti-inflammatory. But alcohol itself is poison to the entire body, including the brain. Have you ever wondered why it is that you get drunk? Why it is that people get tipsy or drunk when they are drinking alcohol? Probably not. It's because of the negative impact that alcohol has on the brain. In fact, being drunk is actually a disease state. A disease is an abnormal condition that occurs because something is impacting the organs in our bodies and is impacting us in some negative way. And alcohol causes changes in the organs in our body, causes changes in the structure and function of our brains that cause us to be tipsy and cause us to be drunk. Alcohol is associated with almost everything bad that we see in this society. alcohol is the #1 date rape drug. Alcohol is associated with a certain percentage of house fires, a certain percentage of accidental drownings, a certain percentage of the traumas that we see and the violent crimes that we see. And the reason why that's the case is because of the negative impact that the alcohol is having on the brain. Alcohol is impairing our decision making. It's decreasing our ability to solve problems. It's disrupting our ability to form and retrieve memories. And the way that alcohol is doing this is because of the impact that it's having on these little chemicals in our brains called neurotransmitters, as well as it's changing the structure of our brains. And I'll talk a little bit about that in just a bit. So when I say that alcohol changes the structure of the brain, what is it exactly doing? It is actually causing our brains to shrink. So whenever we go and we take that first glass of alcohol or that first sip of alcohol, it's causing dysfunction in brain cells. It is causing dysfunction in neurons. What makes neurons so incredibly important to the brain is the neurons' ability to connect with each other and to communicate with each other. And alcohol prevents that from happening. And not only that, but when we start drinking, the alcohol actually dehydrates the brain. And so we can see that the brain starts to shrink and shrivel up as a result. So if you go out for a night of drinking, not only are you causing dysfunction in neurons, but you're actually causing your brain to shrivel up. If you just do it for one night and then the next day you sort of recover, you drink plenty of fluids, you don't do it again, well, your brain is capable of plumping back up, right? The brain has a great amount of reserve. And as long as you kind of abstain from the alcohol, your brain will do fine. But with repeated exposure, those changes that I described can actually become permanent. So have you wondered why it is that drunk driving is actually a thing? Why, when people drink alcohol and get behind the wheels of a car, they increase the likelihood that they're going to be involved in a car accident and that they increase the likelihood that they may kill themselves or even worse, kill someone else? The reason is that alcohol slows down our brain. Alcohol is what we call a central nervous system depressant. It slows the activity in our brain. It causes delays in our reaction time. A few years ago, I was out at a lounge and everybody's sort of around dancing. And there was a woman who was dancing a few feet away, and she had this glass of alcohol in her hand. And initially, she was dancing pretty good. And then after taking a few sips, her dancing became very clumsy. In neurology, we say that it became ataxic. The reason that why it became ataxic is because the alcohol impaired her coordination. The alcohol actually caused dysfunction in a particular part of the brain called the cerebellum, which is responsible for our ability to coordinate our movements. We often see that when people are out drinking, right, they start getting a little sloppy, they start tripping over themselves, they become ataxic. It's because of the impact that the alcohol is having on this very specific part of the brain called the cerebellum. When we think about just how alcohol impacts us, not just short term, but also long term, alcohol can make us feel really confused in the short term, right? We have difficulty sort of figuring out where we are and what we're doing. But alcohol is also a significant risk factor for dementia. I see people all the time who develop dementia related to alcohol. And in a society where people tend to be concerned about Alzheimer's disease, there are things that we can do every day to minimize our risk of developing dementia down the line. And abstaining from alcohol is one of those things that we can do to minimize that risk. And so a lot of times we hear people talk about how, well, as long as you drink in moderation. The issue with drinking in moderation is that moderation looks different for everybody, right? Some people, their version of drinking in moderation may be a glass of wine every week. For others, it might be a pint of liquor every single day. And if I said to you, if you came to me and I had you do a scan of your brain, and I said to you, look, I see some atrophy, I see some shrinkage of your brain, but it's only in moderation. That would be very concerning. The way that we characterize things, usually it's something looks completely normal, maybe something's mild, maybe something is moderate or in moderation, and then something is severe. In moderation is not a good thing. There is not a single amount of alcohol that is going to be beneficial. So when we talk about the ways that the impact that alcohol has on the structure of the brain, not only does it cause atrophy or shrinkage in the overall brain, oftentimes when I do a scan of somebody's brain, if I see atrophy specifically in the cerebellum, I can tell you that they're a drinker, right? The part of the brain that's responsible for coordinating their movements. But alcohol also causes atrophy in the parts of the brain that are responsible for us making memory, for our short-term memory. And so that can cause cognitive dysfunction. That increases the risk of dementia. So it's not just shrinking in the hippocampus, but this global shrinking of the brain is what leads to people developing full-blown dementia as a result of alcohol. And it doesn't necessarily mean that it's somebody who society would consider an alcoholic. A couple of years ago, I had a patient come to me. He was very, very successful, very wealthy, functional, ran a business. But he had been drinking alcohol, what he would consider in moderation or what he would consider socially, for over 20 years. And now he was coming into the hospital with signs and symptoms of dementia. And I remember his wife saying to me, okay, well, if he stops the drinking today, can he be back to him normal self within a few days? And your brain has this incredible ability to heal, especially when we take away the thing that is causing the damage and then do things that are going to keep the brain healthy. But this man had been drinking for 20 years. So the damage that he was causing had been going on for decades. Stopping today was not going to cause the symptoms that he had to spontaneously resolve within a couple days. This was going to be a long-term process, and he was going to need the support around him to help him get healthier. So alcohol has a tremendous impact on mental health. We live in a time where everybody is talking about mental health, the importance of making sure that we are mentally healthy. I guarantee you, if we took away alcohol, a significant portion of mental health issues would actually resolve. And I know what you're going to say. You're going to say, well, a lot of people actually drink in order to cope with some of the traumas that they faced, some of the issues that they have. And yeah, maybe in the moment, it may help them. But in the long run, it's going to make their depression and their anxiety significantly worse. Drinking alcohol increases your risk of developing depression by 60%, increases your risk of developing anxiety by 50%. All of us in healthcare have seen people who develop psychosis, so they develop hallucinations as a result of alcohol use. They develop problems with the way that they think and process information as a result of alcohol use. So if we're concerned about our physical health, our neurological health, and our mental health, it is in our best interest to abstain from drinking alcohol. So I've often heard people talk about how, they can hold their liquor, and they talk about it so proudly, yeah, alcohol doesn't impact me, I can drink a whole bunch of alcohol and I'll be just fine. Being able to hold your liquor is actually not a good thing, because what that means is that you have built up tolerance. And the only way that you build up tolerance is because you've had so much liquor over your lifetime. Now, and to think that that is not having a negative impact on the brain is actually foolhardy, because while the brain has a tremendous amount of reserve, eventually all of that alcohol use will catch up. And it might be something simple like just an infection, a UTI, that then sort of tips the brain over and pushes that person into a state of dementia. I took care of a patient, young guy in his 30s, not too long ago. He came in having seizures, and he came in specifically having what we called status epilepticus, nonstop seizures for hours. He had never had seizures before. He was a very healthy guy. But that day happened to be his birthday. And for his birthday, he wanted to celebrate. And he wanted to celebrate by going out and drinking. And the alcohol caused his brain to seize nonstop. And in order to get his brain to stop seizing, what we had to do is put him into a medically induced coma for 24 hours. And there was no guarantee that that was going to cause his seizures to stop. Luckily, it did. And when we woke him up and we told him what happened, he said to me, "You know what? I knew that this was a possibility because years ago, drinking, I had a seizure." But for him, in that moment, it was more important to drink and potentially put himself at risk of seizing and put his life in danger than to go out and have sober fun. A lot of people will use alcohol to help them fall asleep. Well, it might help you initially start to fall asleep, but it certainly will impact your deeper stages of sleep. And one of the things that I tell people all the time is that sleep is made for your brain. During sleep, that's when the brain clears out the toxins that have built up throughout the day to keep the brains healthy. That's when your brain turns what you've learned throughout the day and forms it into memory. And if you're not able to get into the deeper stages of sleep, then you impact all of that. Your brain's unable to do all of that. And so what happens with people who drink alcohol to help them fall asleep is that fairly quickly, not only are they not able to stay asleep or get into the deeper stages of sleep, but eventually, even drinking alcohol will not help them go to sleep. And so this has a really negative impact on their overall sleep patterns. So when we think about how alcohol negatively impacts the brain, right, it's toxic to brain cells. It has a negative impact on our brains and their abilities to connect with each other. Alcohol causes stress in the brains that damages brain cell. Alcohol causes inflammation throughout the brain that also damages brain cells and disrupts brain function. Alcohol impacts the neurotransmitters, the chemicals in our brain that are responsible for our mood, that are responsible for our ability to go to sleep, our ability to think, our ability to move our bodies. Alcohol causes structural changes in our brains by shrinking the brain. And alcohol also puts us at risk for neurological, cognitive, and mental health disorders. Alcohol is not only killing the brain, but it's also killing you. And so that's the end of my presentation. Thank you.
Wonderful. Well, thank you so much for such a great presentation. And, I think that we're going to have a lot of really good discussion and questions towards the end here. Next, what we will do is we will have Dr. Adesina come up to the stage here, and then I will get your slides here in a moment. And let's see, we'll have you unmute yourself, and then we'll have you take it away.
All right, thank you very much. That was a wonderful talk on the dangers of alcohol on the brain and mental function. So I'm happy to be here and talk about how it affects the eye, which is actually embryologically and developmentally comes from the brain and is very, very much connected to the brain. My name is Rafe Adesina. I'm a neuro-ophthalmologist, board certified ophthalmologist here in Houston at UT Houston. I have no financial disclosures related to this talk. We're going to talk about initially the basic structure and function of the retina and optic nerve, which are the parts of the eye that are affected significantly by alcohol toxicity. And we're going to talk also more about how it affects optic nerve function and how this in turn affects vision and some of the visual symptoms that you can experience due to alcohol toxicity. So what is vision? Vision is our sense that we use to perceive the world. The eye is akin to a camera. where light rays enter the eye and are transmitted via a connector to the brain where we process vision. And that connector is the optic nerve. So even though we feel that we see with our eyes, we actually perceive vision, and it comes to consciousness in our brain. This is a picture of the back of the eye, also called the fundus. And we see here the optic nerve and the blood vessels that supply the back of the eye and the inside of the eye. And we also see, I say quote unquote, see the retina. And the retina is there, but in fact, healthy retina is transparent. You can't see it. The redder color that you see in the picture is actually from the deeper blood vessels beneath the retina that supply the inner retina and the part of the eye called the choroid. And in cross section, what you see here is an enlarged photo, a large depiction of the back of the eye, where you see that the layers of the retina is actually made up of layers. There are actually 10 layers of the retina that consists of cells of different kinds, including neural cells. And the retina is transparent because light must go through all layers of the retina, from the inner retina to the outer retina, where it reaches the light sensing cells called photoreceptors. And these are the rods and cones in the back of the eye. And what they do is they turn the light signal into a chemical or electrical signal that is then transmitted back up through the retina and initially processed by the nerve cells called ganglion cells. And these ganglion cells have long nerve fibers called axons. And these axons stream together in the back of the eye to form the optic nerve. And that is the initial connection that takes this chemical light electrical signal to the brain, where it again is processed. The center of the retina is called the macula. And the macula is where we have the highest concentration of our cone cells, where we process our clearest and sharpest vision. And for that reason, this area of the retina is the most metabolically active, requires the most energy and blood supply. And that's important when we talk about how alcohol affects the eye and the visual symptoms that occur when that happens. So we'll talk about how alcohol affects the eyes directly, also indirectly, and what those effects are on the vision. So we talk about alcohol, we think mostly of ethanol, which is the alcohol that's found in beer, liquor, the drinks that we take or that people drink. But in the fermentation process, you not only get ethanol produced, you also get methanol. And methanol is also known as wood liquor. It's moonshine. It's found in windshield wiper fluid, in paint thinner, certain perfumes. And this type of alcohol is very, very toxic. And we'll talk about both how methanol affects the eye and body, and ethanol as well. We'll talk first about methanol and the dangers of what methanol can do to the eye. Methanol is extremely toxic. It causes direct injury to the retina and optic nerve and to the body as well. This is because it is broken down by the body into a substance called formic acid. And formic acid is not very well removed from the body. It's not very well excreted from the body. So it builds up very quickly in the body. And even very small amounts of methanol substrate formic acid is very toxic to the body. So as it builds up very quickly, it causes direct injury to the retina and optic nerves, to the brain, to the heart, lungs, and kidneys. And if not treated quickly, can rapidly cause irreversible blindness and also death. Ethanol toxicity, on the other hand, is less of a direct injury in adults, but also can cause direct injury in the developmental stage. It can be severe, usually causes gradual chronic heavy vision loss in drinkers, but again, can be irreversible once damage is done. So ethanol toxicity in the developmental stage, when babies are developing in their wombs and their mothers are drinkers, can be associated with developmental defects associated with fetal alcohol syndrome. And That causes defects in cognition, in facial features and growth. It can cause behavioral issues, and it can cause underdevelopment of the optic nerve called optic nerve hypoplasia, and that affects vision. Okay. Again, it also causes misalignment of the eyes and other issues with the vision in children that develop this. And this happens in over 90% of patients or children that are affected by fetal alcohol syndrome. Heavy long-term drinking is associated with tolerance to alcohol, like Dr. Douyon mentioned. And when that happens, you need to drink more and more alcohol to get the quote unquote desired effect. And the more alcohol you drink often leads to deficiencies of very essential and necessary substrates for health of the body. And these include vitamin B12, folate, and thiamine. And these are all very necessary for the proper function of the body, production of red blood cells, neurologic function, energy production, and specifically in the eye are very necessary for function of the central ganglion cells in the macula that subserve our fine central vision. And if you don't get enough of these vitamins, you develop insidious progressive vision loss and damage to the optic nerve called atrophy. And this is irreversible. And because it's a central part of the vision, you lose your central vision first. And in some cases, in people who are predisposed to having hereditary optic nerve or vision problems, these deficiencies can actually trigger these other optic nerve diseases and make them more severe. So just as an example, this is a picture of optic nerve hypoplasia here on your right. On the left is a normal optic nerve, and on the left is an underdeveloped optic nerve in a child that's been affected by fetal alcohol syndrome. Here, again, we talked about the fact that the central retina is very metabolically active. And when you have deficiencies of vitamin B12 because of excessive alcohol drinking, you can develop optic atrophy. We see that the outside parts of the optic nerves are pale. They are not as pink as the inner parts of the optic nerve, and that's atrophy. That's scar tissue from damage to the optic nerve. And we see in the visual fields that are associated with these patients, they have lost central vision. And again, it's not treatable, the central vision, once the optic nerve has been injured and developed scar tissue. Thiamine deficiency is also a part of alcohol use, and thiamine is also called vitamin B1, associated with Wernicke syndrome, Wernicke encephalopathy, in which patients develop a triad of balance problems called ataxia, like Dr. Douyon mentioned. They also get uncontrolled eye movements or nystagmus, and they can get confusion. Wernicke's optic neuropathy is rare, thankfully, but this can happen in a short amount of time, relatively days to weeks, with thiamine deficiency. And you can develop very severe, very profound vision loss. The cases that I've seen, patients have been able only to see hand motions or counting fingers vision. You can even go blind from it. The treatment is to get patients their nutritional supplements of thiamine very quickly. And in fact, thankfully, once you do that, you can actually see pretty significant improvements in vision. It's one of the only ways you can get vision back due to alcohol toxicity, so to speak. You can also get thiamine deficiency from other causes, excessive vomiting, eating disorders like anorexia and bulimia. We're not getting enough nutrition in your body. This is another way that alcohol can affect the eyes and the vision. So these are some of the visual symptoms associated with alcohol use. Again, because of central vision affected, you get central scotoma, central vision loss. Because the rods and the cones are concentrated in the center of the vision, again, when that part of the retina is affected, you can lose your color discrimination. You have color deficiencies. Because alcohol depresses the central nervous system, it causes inhibition of function. Your eye movements become affected. You can get double vision. You can get what's called nystagmus, which is uncontrolled eye movements where your eyes bounce and shake around and cause debilitating visual symptoms called oscillopsia, where your vision literally shakes back and forth. And again, as Dr. Douyon mentioned, chronic alcoholism can lead to cognitive issues, dementia, memory loss, balance issues, cerebellar dysfunction, and all of these can affect the eyes and the vision with visual perception, because again, vision is perceived, it's processed, it comes to consciousness in the brain, and any effects it has on the brain, especially in the vision processing part of the brain, can affect your vision. So how do you take care of patients with alcohol toxicity? Well, with methanol, it's a medical emergency. These patients are in the hospital. They need to have dialysis to remove the toxic formic acid from their blood and from their system. In fact, sometimes we give people ethanol or a medication called fomepizole, which inhibits the body from breaking down methanol into formic acid. It actually breaks down these substrates instead, which are not as toxic and more easily removed from the body. But again, medical emergency, do not pass go. These patients need to have pretty intense medical therapy and medical treatment to prevent them from having significant vision loss and other complications in their body. For ethanol, the key really is sobriety. Once there is damage to the vision, unfortunately, it's not recoverable, it's not recuperable back to normal. So we need to prevent further injury, further damage to the vision by preventing the ingestion of more alcohol. Once vision is done, we can do our best to supply vision aids, vision rehabilitation, to adapt to the vision loss that you've experienced from the alcohol toxicity. But again, it's hard to bring vision back that's lost once there's atrophy and scarring and damage to the optic nerves and the retina. So in summary, the optic nerves and retinas are very important and sensitive neurologic structures, organs of vision. Alcohol can cause direct and indirect injury to the retinas and optic nerves. Methanol toxicity is a medical emergency, usually seen in accidental ingestion, or unfortunately, in some cases, when individuals want to harm themselves. But again, that needs to be taken care of as a medical emergency. And ethanol toxicity, alcohol toxicity, as we generally know it, is insidious and can be prevented by sobriety, much more than moderation. As Dr. Douyon said, again, there's really not a very safe amount of alcohol to drink. We want to make sure that we are preventing the risk of long-term damage to our vision by minimizing exposure to these toxic substances. And that is my talk.
Excellent. Thank you so much, Dr. Thank you so much, Dr. Adesina. I'm going to bring up the rest of the team here again. Now, I know someone is probably thinking it, but what about, my doctor says a glass of wine a night is supposed to be good for my heart. What about every now? Any thoughts about that there? So I know somebody has to be thinking it.
So I would say that alcohol is associated with cardiomyopathy. So your heart muscle does not function well, and that leads to heart failure. Alcohol is associated with arrhythmias such as atrial fibrillation, which lead to stroke. So there are dangers in drinking alcohol, even what we might think of are small amounts.
Yeah, I have to co-sign that. I think you mentioned that earlier, Douyon, that it's not the alcohol and the alcohol that's the health benefit. It's the other substances in the alcohol or the drink or the substance that are beneficial to the health. So yeah, I can't co-sign drinking alcohol to make you healthy. It's just other things that are in it that are probably having beneficial health effects.
Dr. Laroche, do you have any comments or questions at all?
Yes. This is for both of you. Do you recommend complete abstinence from alcohol?
So I do recommend complete abstinence from alcohol, just because as a neurologist, and I'm just one neurologist, every time I'm seeing patients, I will see at least 3 to 4 patients every single day who are in that ER having some kind of neurological emergency because of alcohol, whether it's a stroke, a seizure, whether they just got into a car accident or fell off an ATV or something. And, granted, look, people are going to go out and do what they want to do, but they at least need to be informed about the short-term consequences of just even a night of drinking and the long-term consequences.
There's really no amount of alcohol that you could say is safe. And because every individual is different, and reacts to alcohol differently and processes it differently. I can't say that, yeah, go out and do this and it's going to be fine. Personally, I co-sign that um, analysis that it's not safe. So sobriety is probably the best way to keep yourself from having these issues from a neurologic, systemic, ocular standpoint from alcohol.
We're on the front line when we're dealing with patients. Although we're specialists as eye care providers and neurologists, we're in the community, and we see a lot of people that will come in and they say they socially drink, maybe one or two drinks on the weekends, or at a business meeting and things of that nature. What is your best way to tell them to like really not do that? Within we only have so much time to spend with the patient. What is your best technique, one or two lines, to really advise them about the dangers of alcohol and stopping to drink?
Well, I feel like for me, when I'm specifically working with men or helping take care of men, there's only two places that you really need to hit men to get them to do things: in their wallets and in their pants, right? And so alcohol leads to erectile dysfunction. There are even studies that show that if you are trying to conceive a child as a man, right, you're trying to get your partner pregnant. If you're drinking around the time of conception, the negative impact that alcohol is having on your sperm leads to the potential for neurodevelopmental issues in that child. And so, yeah, I'm just like, if I'm talking to men, listen, there's not enough little blue pills that are going to help you get it up if you're drinking alcohol.
We're
And
about to women.
and to women, so alcohol, so we all kind of understand this idea of fetal alcohol syndrome, but alcohol also impacts their eggs. And while men, we're making sperm every single day, women are born with only a certain amount of eggs that they're losing throughout their life. Alcohol is decreasing the quality of their eggs. It is causing genetic mutations in their eggs. It's having negative impact on their hormones. So if you ever want to get pregnant as a woman and have a healthy pregnancy, you're better off staying away from alcohol.
Vision is one of our most precious senses, and there are people that say, "I'd rather go blind. I'd rather die than go blind." Well, if you drink enough alcohol, you're on the train to blindness, and once you are there, we can't bring it back at the station, off the train, and it's moved on. So the idea is to help them understand that, again, every individual is different. I can't tell you what safe amount of alcohol is going to be for you. And the best way to preserve this precious sense of vision for yourself, for your families, for your livelihood, because most of us can't work if we can't see. We can't put bread on the table if we can't see. Then I would need you to consider staying away from alcohol, especially if you have a family history of alcoholism that runs in the family. If you know personally you've had issues with drinking, and that's got to be taken into consideration.
Yeah.
This is such an important issue in the community. In many of our communities, we have liquor stores on every block. You're not going to see a show like this on CNN or Fox because they have alcohol companies sponsor them. Entertainment people are promoting the alcohol at their concerts, at their events, on the media, at the games. I mean, alcohol is like ubiquitous. So what do you think are some of the best strategies to try to fight this media beast that's all over in our communities, all over in our media? I mean, what we're doing here is a step in the right direction. But do you have any other strategies to try to better educate our community so that we don't harm ourselves with this toxicity?
Yeah. So I think you're spot on when you talk about the media, because I was shocked to see that ESPN, the NBA playoffs, it's sponsored by alcohol. Like they're promoting the alcohol while they're doing their analysis, you know. And we have all these celebrities that have their alcohol brands. J Lo, who 2 years ago or 3 years ago did an interview where she was like, "No, I don't drink alcohol. Like my parents used to tell me that if I drank, it'll kill me, so I don't drink." Then releases an alcohol company and backtracks her statements, right? So we have these big time celebrities who are putting this toxin out into our communities. And while they're making their millions, they're killing their people. They're killing our people. And so it's really hard to go up against that. And I think, as doctors, we usually are focused on the individual. We see a lot of individuals. I think we can use platforms like this to certainly have a much wider audience. But I think that's how we target. We target individuals. We use platforms when we can. But we also, as doctors, all need to be on the same page, right? I can't have a cardiologist telling his patient drink a glass of wine per day, and as a neurologist, I'm like, dude, your cardiologist is out of his mind. Right.
It's difficult.
Go ahead, Dr. Adesina.
The media is pervasive in society, right? That's where we get a lot of our cues, how to behave, how to act, what is important, what is good, what is bad. And the same way that the media uses itself to advertise, promote alcohol, maybe we can encourage those in places of power, right, to do the opposite. Tell the stories of lives injured, of vision lost, of lives lost, of the dangers of it, through the media, and also start with the kids young. Start with the next generation. Help them understand that it may look cool, it may sound cool, but it's not cool. You want to have a future, you want to have a life, you want to be able to take care of yourself and your family. And the earlier we get that message out, to the community, the better. Then also those in our community who have the wherewithal to be on TV, to be in the media, promote a different message, a better message to our young people and to our communities at large.
Aaron, I think we have a couple of questions in the chat. Go ahead.
Yeah, so I think we may have talked a little bit about this, but Dr. Monique Barber, she's a member of NMA Ophthalmology. Her question is, is there a difference between different types of alcoholic drinks, if one's worse than the other? For example, a glass of wine versus a glass of beer versus a shot of something else. My disclaimer for myself is that I really don't drink alcohol because it makes me incredibly sick. If I do drink, I have to take Zofran. So I choose, honestly, not to drink. But any thoughts towards different types of alcohols, one worse than the other versus something else?
So I would say potentially yes, but the reason why you have to take Zofran is because your body recognizes alcohol as a poison, which everybody's body recognizes as a poison. But you might, maybe you're a little more sensitive than some other people. Some people would tell you like brown liquor is worse, but I mean, I would not let this up to an individual to then look at an alcohol and be like, oh, this one's better, this is worse, right? Like we know as doctors, it's very hard to get patients to always engage in the healthiest behavior. And you want to make things as simple as possible for them. We know all alcohol is bad. Yes, some is worse, but it shouldn't be up to the patient to decide which is going to be worse for me.
Yeah. Alcohol is alcohol is alcohol. Just a matter of how much alcohol is in it. You break down the structure of liquor versus wine versus beer and get down to the alcohol. It's the same ethanol, just a different amount that's in it, right? Now, like I said, wine may have antioxidants and things that may be also beneficial for your health. But at the end of the day, what's causing toxicity is the alcohol. So in my mind, there's no difference between the alcohols. That end organ damage, that end game is to cause injury to your body. So I wouldn't differentiate between the different kinds of alcohol. Just how much is in one versus the other, and how fast it can cause whatever it's going to cause.
One alternative at a conference recently, they were serving, instead of alcohol, they were serving mocktails, which is like these drinks that look like an alcoholic drink, but it's not alcoholic, and it has some fruits and different colors. And this is a growing business. And I think that as a community, when we have celebrations, get-togethers, where you say you're going to go out for a drink, a mocktail, a non-alcoholic cocktail, is a way to still be social, have a business meeting, and things of that nature. Do you have any thoughts about that? Have you seen that, these mocktails, and any thoughts about that?
Yeah, so I actually know somebody who's created a mocktail company, and she's a black woman who's created a company. I mean, again, you've got to look what's in it. Obviously, it's not alcohol. I don't know if they're loading it up with sugar or, or what the issue is. But to your point, right? People do want to look like they fit in. And if they're not drinking and other people are, like they want to, pretend like they've got something in their hand that might be reflecting alcohol, and it may be a good alternative.
Yeah, I agree. It depends on what's in it. If you're drinking socially because you want to kind of fit in, drinking alcohol for the flavor or the taste, and maybe it's not the alcohol itself that's what you desire, then it's an alternative. But if it's full of sugar and it's full of you know things that'll cause diabetes later on in your life, then be careful how much of that you're going to be drinking. Um, you got to be you can't get rid of one poison and start drinking another. That one definitely has to be in moderation to prevent potential health issues down the line. But in terms of mitigating the social and health effects of ethanol, it's an alternative.
Back to good old water.
Back to good old water.
We're made of. They said we're not made of ethanol. We're made of water.
Yes, indeed. Yes, indeed. Go ahead, Aaron.
Someone who might listen to this stream, they might be struggling with alcoholism. Are there any suggestions or tips that could be like a first step for them in order to help get rid of the alcoholism?
I mean, I think the first step is always awareness. You have to be aware that you're having a problem. And, a lot of people struggle with that. So even people that we may consider to be functional alcoholics, that's really that they lack awareness to see how it's really negatively impacting their life. And I think once somebody becomes aware, and they're truly committed to changing, then they can start taking steps that, will help them overcome the alcoholism. And they have to be mindful that they're going to be triggers sometimes, right? They're going to be triggers like maybe it's on your walk home from work, you pass by a bar that you normally frequented. Maybe it's the people you spent time with. So you're going to have to be willing to make some significant changes in your life.
Yeah, that's a really important concept. What triggers you to drink, and why do you drink? Do you drink socially? Do you drink for the effect? Do you actually enjoy drinking? I was listening to a podcast the other day, and the actual act of doing the thing that's causing the harm, do you actually enjoy that? And they were talking about smoking, and this therapist asked the person, do you enjoy smoking? Do you actually enjoy the taste of the smoke? Is that good for you? I want you to, next time you smoke, I want you to do that and see if you actually enjoy it. And they went home, and whatever triggered them to smoke made them smoke. And as they were smoking, they actually tasted the smoke. They tasted the cigarette. They're like, this is gross. Why am I doing this? Like, if you actually think about what you're doing when you're doing it, and not just trying to get the end effect, that might be a huge motivation to stop doing it. So again, not for every drinker. I think awareness obviously is the first step, like Dr. Douyon mentioned. But when you do that, take a hard look at why you're doing it. What is the reason you're doing it? Is it for emotional issues? Is it for um, you know triggers that make you do it? Is it for the effect itself? You actually enjoy the taste of alcohol, and you might realize that maybe I don't really like this. This is not actually good, and find something else to substitute for what alcohol gives you. Um, I think Alcoholics Anonymous and those kinds of support groups are really good at getting people sober, but it's going to take you getting help and having a support system that will support you in getting better. It's hard to do this by yourself.
Excellent. Dr. Laroche, any other thoughts, comments, or questions?
No, I think that this was great. Um, this is an important topic. I want to thank all y'all for coming together this evening to spend some time on this. I want all those that are watching it now and that will be watching it in the future to please share it in the community on your social media platforms to get the message out to our colleagues, to the community, to the young folks so they can get this information that they're not going to get from mainstream media. And then also, before we end, Dr. Douyon and Dr. Adesina, please let the people know where they can reach you, in that respect, if people want to follow up with you and talk to you in more detail.
Yeah, so people can always visit my website, the InleBrainFitInstitute.com. So INLE BrainFitInstitute.com. They can find me on social media platforms, including like Instagram, where my handle is Phillipe.md. Facebook, LinkedIn, TikTok, although I don't dance on TikTok, but I did think about doing something dance related recently. So we'll see.
I am here at UT Houston in the faculty of the ophthalmology department. I see patients here and at the county hospital as well. I'm on LinkedIn. You can meet me up there. I'm not really on social media. Otherwise, try to stay away from that personally. I host 2 podcasts myself, one on neuro-ophthalmology called Out of the Blind Spot, and then another one called Sight for Sore Eyes, where I address issues of diversity, equity, and inclusion in the field of ophthalmology. So happy to interact. Need to be seen for vision issues. Happy to get you into our wonderful clinics and departments here. Yeah.
Excellent. Well, thank you both so much. We're very appreciative of your time, both to Dr. Adesina as well as Dr. Douyon. Let us continue the conversation after this live stream is posted. Feel free to share with your family members, with your friends, individuals at work. And if you have any other questions or comments, feel free to share that within the YouTube video itself. And if there are any other topics that you would like to learn about, would like to listen about for the future, feel free to also let us know. Dr. Laroche, any other thoughts at all?
No, that's it. Once again, thank you very much. For those watching, please like and share. Please let's get the information out to the community. And thank you both gentlemen for joining us tonight.
Thank you.
Yes.
Thank you
Thank
very
you
much.
all again. All right.